And one of the examples is when we do a lot of botanical research, we found a lot of the natural product or plant or herbal extract are very active in the test tube. When we give it to people, they're not that active. One reason is you don't absorb them enough. One example is the chemotherapy drug Taxol. It came from the tree bark, from Pacific yew tree, but you need 60 pounds of these tree barks to extract enough drugs to as one dose. So if you just take a few capsules of this tree bark, it's not going to do anything. So we need to refine, to do more sophisticated research, and so that we can dig up the best part of them and maybe make them, formulate them in a better way so it can be applied in clinical practice.
Thank you very much for your program today. I'm a stage 4 breast cancer survivor, was diagnosed March 7th of 2005. And I'm also a patient of Dr. Lois Teston from University Hospitals. But I'm undergoing a clinical trial right now at the NIH for PARP inhibitors. And my question really has to do with diet. I was not ever really informed too much about diet during my first 4 years of cancer treatment, but I have currently switched over to a macrobiotic diet and want to know more about why diet isn't brought in earlier into treatment, and also what is the evidence base for macrobiotics or diet in supplementing treatment?
Diet, I think, in my opinion, plays a major role in cancer prevention. And during treatment and after treatment, their role are slightly different. So our priority when we're advising patients on diet is a little bit different. In your case, your macrobiotic diet, for those who don't know, is a mostly vegetarian diet with very strict ritual on preparation of the food and emphasize on natural raw food and so on. I think, in my opinion, this diet may not be helpful for some people because if it relies heavily on soy products, and for certain breast cancer patients because they have estrogen receptors, and there is a concern that estrogen-like material in soy product may actually stimulate these cancer cells. There's no definitive proof that can happen, but if you look at the laboratory data, that's possible. So when you weigh this benefit and risk, this is probably a risk you do not want to take. And there are efforts in trying to incorporate dietary advice in cancer care, I think, but there are a lot more need to be done. But the integrative medicine program here and elsewhere in the country, they're trying to do that.
I also appreciate your being here. I wish I could ask you a controversial question, but unfortunately I agree with everything you said. The reality of my life, and it's also a stage 4 melanoma, my daughter question, she's the captain of her own team, and so she's elected to do massage therapy and organic foods and a strict eating plan. She's gone a variety of places, and she's done her own research. I understand your comment about needing to do long-term research. I can't disagree with that. But the reality is we're alive today, and we need to know today. For example, the last place she went to, Camelot Cancer Care Center in Utah, I think. How does one evaluate, without having the long-term research, what's best to do now? Or she read about a program in Berlin that she considered for a while and then dropped.
Well, I think there are new opportunities here, because what you're basically saying is that, if you've got advanced cancer, you don't have time to wait for the research. You're going to do your own thing anyway. And then there are some people who do dramatically well, and they prolong their lives, and they have a very strict lifestyle where they stick to particular nutrition and particular exercise regimen, etc., and sometimes certain botanicals. What I think we need to do, obviously this is going to happen, this is still research. If we document it and write it down and gather the evidence from large numbers of people, we can actually look back. It's not as good as what we call prospective research, but clearly in research you do the best you can with what you've got, and it's better than doing no research at all. So what we do have nowadays is many ways of actually looking at your blood cells, the way your genes express themselves, and there may be certain, for example, what we call gene profiles, which is the way your genes reveal themselves in your body, which change according to your lifestyle. And we can actually show maybe that some people are actually switching off certain cancer genes by their lifestyle, then clearly that would be a very important piece of information, because then you could predict in certain people maybe what sort of lifestyle they should be following, whether it's more likely to be effective. So research doesn't necessarily mean a randomized controlled prospective clinical trial. Obviously that's what we like to do, that provides the strongest evidence, but we use the best we've got in the situation, and the most important thing is that the people are surviving, they're feeling better, and they're having a good quality of life. But you are still useful for data that will help other people in the future.
I think we have a lot of patients saying exactly what you just said. You can do all the research you want, but I have cancer today. What can I do today? So I think the approach is to weigh the benefit and risk ratio. If there's something that has an established safety record, we know what it is, what's in it, how it works, at least we know it's fairly safe, and there is a potential of benefiting patients. I think we should be able to make them available to patients. And while there are other things that may be high risk, in that case, you really have to justify the risk the patient is taking by taking the substance. Then you need a much higher bar of efficacy, effectiveness to recommend that. So this has to be tailored to patients' individual situation, their medical history, other medication they're on, other medical conditions they're on. That's why we have these integrative oncologist professionals that's being developed around the country and make our service available to cancer patients. And I think it's important for patients and the public or family members to find someone who is a professional, who knows a lot about these things, who knows not only the benefit, also the risk, and how to have some medical knowledge and how to tailor that to your individualized, personalized care. And I think in Cleveland this is happening. There are many such professionals available.
Thank you, gentlemen. Today at the City Club of Cleveland Forum, we have been listening to Dr. Stephen Sagar and Dr. Gary Deng. Thank you, doctors. Thank you, ladies and gentlemen. This forum is now adjourned.
For information on upcoming speakers or for podcasts of the City Club, go to cityclub.org.